Folks, thank you for joining us today as we talk about and discuss one of the carriers that we feel is a must-have for your portfolio for this AEP and the year of 2023 moving forward here in North Texas. And that is our friends at CareN'Care and how we feel they need to be part of your North Texas Medicare Sales Plan, this AEP. This presentation is being recorded and will be made available through our website at premiersmi.com and on our YouTube channel as well. And in addition, you'll find in the software package that there is a section for both questions and chat. Please use the questions section. We find that we cover most of them through the course of the presentation, but we will check periodically to make certain that we do so in today's broadcast. We'll start with a little bit of level set about Premier Marketing, since this presentation is presented to agents of all experience and exposure to both ourselves and CareN'Care. We want to make certain that we remain a bit rudimentary in our approach, but we also give you the detail that you need to make certain that you get full value out of this presentation. So as we speak of Premier Marketing, we are a national marketing organization founded in 1968. As part of the Integrity Marketing Platform, we have offices across the country. We're licensed in all 50 states. We act as an insurance wholesaler working through independent agents and agencies such as yourselves, and do so through contracts that are at the highest possible commission levels, with recruiting contracts available to those who qualify. We do so through a full portfolio of products, including the Medicare programs like we'll discuss today, the Medicare Advantage programs, but also Medicare Supplement and standalone Part D prescription drug plans, sometimes referred to as PDP plans. But we also have a full portfolio of life insurance and annuity products, final expense life insurance, pre-need plans, long and short-term care programs, disability income programs, and ancillary benefits such as dental, vision, hearing, critical illness cancer plans, hospital indemnity, accident and telehealth programs. Those Medicare Advantage plans include the national carriers and many of the strong regionals, such as what we'll discuss today with our partners over at CareN'Care. And that same philosophy carries over into the standalone prescription drug plans, where generally these come as part of your Medicare Advantage contract. A couple of exceptions. Humana is a separate, not Humana. Mutual of Omaha is a separate contract from many of their other products, and CleverRx is a discount program, not a Part D program. The Medicare supplements that we offer are varied, and we have special programs set up in place to make you successful in this space. CareN'Care has an excellent managed care program that acts somewhat as a Medicare supplement program, but I don't want to steal Steve's thunder too much, and we'll let that go. When we look at the ancillary products in each of the categories, the national carriers are there for you. In many circumstances, the Medicare Advantage programs will offer some of these, the dental, vision, hearing particularly, but at the other areas, sometimes those are a natural fit when we look at managed care programs for Medicare beneficiaries. We talk about this all the time simply because the majority of people on Medicare are not doing their evaluations year over year. We're confident that's probably going to happen this year as well. We hear from a couple of the folks out there that do surveys that this might be a year of more intense shopping than perhaps last year, but what we have is an opportunity to make certain that people have the detail they need to pick what may well be the best program for them. And we do so through an opportunity of presenting this information virtually and in person. The technological skills that we have now, the tools that are there, help you to become all online, still help you in person, or perhaps be that hybrid to work both fields, as many do. And that's because the population we serve is increasingly digitally savvy, because they've been taught by their doctors, their specialists, their hospitals, their dentists, and even their churches, synagogues, and mosques to receive information electronically, and in many cases, take care of many certain needs through the joys of the internet. So what we've done today is ask our friends at CareN'Care, particularly our good friend Steve Plocek, to come on board and visit with us about the programs that they have to offer for this coming year and what makes CareN'Care a special carrier for you. So at this time, I'm going to turn control over to Mr. Plocek and ask him to take it away.
All righty, big guy, I'm with you. And hopefully my screen is popping up here. I'm gonna make it a little prettier here. So John, are we good to go? Basically, you seeing a little 2023 AEP kickoff?
I do indeed see it, Steve.
Outstanding. Well, as always, John, it's always a pleasure working with you, and most certainly with Premier. But I thank you most certainly for your time. I think all of your agents, we know basically from just our background, that's a very tough task that they have. Being agents, working out there in the field, basically within our communities, that's not an easy role. And I want to thank every single one of you for what you do. It's remarkable what you guys do, the way you educate your communities, the way you help your individuals understand the maze of Medicare. And I want to be one of those partners with you guys. But let's go ahead and get started. Let's talk about a little bit of 2023 benefits here. I am very excited about our opportunity that we have. We are staying basically the same areas. We have a lot of stability that you'll see over the next couple of slides that I have for you this afternoon. But all in all, CareN'Care is a local plan. You're going to hear me talk about local, something fierce. Okay, you're going to hear me talk a lot about local, but we basically are in 13 counties, including and wrapping around the Dallas-Fort Worth Metroplex. We have 4 PPOs, we have 2 HMOs. You will see on your screen right now that one of our HMOs is listed in red, and it is listed in those the counties in that scenario. So all of my plans except for the HMO Southwestern Health Select plan are in all of my counties. That Southwestern Health Select plan is only in those specific 5 counties: Dallas, Tarrant, Denton, Collin, and Rockwall counties. It's where the heaviest population is within that footprint and within the North Texas area for sure. But those are what our plans are. No change year over year. Same o, very consistent with those plans. And we'll talk a little bit more about those specific plans as we go through the presentation. But before we do that, what I'd like to do is I'd like to talk about my parents. And not my true biological parents, but the parents of basically CareN'Care. For individuals that are here in the area, and strange enough, basically, I heard in a past career, I heard 2 individuals talking in the coffee shop, specifically about UT Southwestern, and I happen to be in Wisconsin, of all places. They were talking about UT Southwestern, and I wanted to get into that conversation, something fierce. But all in all, these are nationally known organizations, hospital networks that own us. Texas Health Resources and that UT Southwestern. We are locally owned. I'm here locally. Our customer service is local. Our claims, our appeals, we're here local. This is a North Texas plan serving a North Texas community. Talk to you about a whole kind of marketing, and you know, I kind of feel this slide's maybe a little overkill, but at the end of the day, if you work this market, if you understand basically this North Texas, even if you don't happen to live here, you will see or you will know basically these 2 names and how impactful they are within our community. Well, let's go ahead and get started. We're going to get started with our most popular plan. So again, I have 4 PPOs. We're going to talk about those 4 PPOs and the 2 HMOs. We're going to start off with our most popular PPO that we have out there. You're going to see on your screen what we have today in 2022 and what our benefits will be in 2023. We still have a 0 premium plan here. We did move up our maximum out of pocket from a very aggressive, even in the PPO area, of $3,900 to $4,200. A lot of people would look at that at $4,200 in network, even $8,950 out of network. That's pretty aggressive. Are you sure this is a PPO? I am most certain that this is a PPO. We have that same, if you see it in white, not going to probably spend a whole lot of time on that. But all in all, same year over year PCP, 0 in, 25 out, specialist 35 in, 70 out, podiatry, a little better on the out there, but 35 in and 60 out. Inpatient hospital did hop up just a little bit, try to make it a little easier at the end of the day, but all in all, just day 1 through 5, 250. That is a bit of an increase. You will see, that we'll have some green here. We definitely have some increases in our plans, making it better, making it richer. We look at where our financial state is of our organization. You've gone out and had to buy a dozen eggs. You have 2 young men, basically an 18 and a 21-year-old. We like breakfast for dinner at our house, right? So we eat a lot of eggs. Cost is crazy. So if we have anything that's flat or not moving a whole lot or giving you more than what you had a year ago, I think that's pretty exciting. That's good stuff to talk about out there. But all in all, skilled nursing facility, a little more aggressive. You're not having any kind of co-payment those last 50 days, days 51 through 100, 35 out, a little more aggressive than it was with the 40. Nurse line. Didn't have a nurse line before, so we've added basically. You have a client, you have an individual sitting there at home wanting to talk to somebody, isn't going to talk to a doctor basically 9 o'clock, didn't want to bother the doctor, but still has a little question. How do I handle this? What should I do? Is there an OTC basically, strategy that I could use? Or, hey, do I need to get myself to an emergency room or an urgent needed care? My next point, very interesting and very exciting to me. This is authored, this is set up, this is driven by one of my parents, Texas Health Resources. It is Texas Healthcare at Home. So let's look at this co-payment here. Day 1 through 5, $250. If I look at what my inpatient hospital is, it's $250 per day. So let me read the last paragraph here. I'm going to read this out to you, and I always kind of struggle with one of the ailments. You will receive treatment and monitoring at home from a team of providers. Conditions which are eligible to be treated with this benefit can include asthma, bronchitis, and other respiratory system diagnosis, heart failure, shock, simple pneumonia, palsy. I always mess that one up. I know I didn't say that right. Palsy. Excuse me if I apologize for messing that up. COPD, cellulitis, kidney and urinary tract infections, UTIs. So bottom line is, if you have a client that basically is suffering from one of those, they have a safe, they have a home that, everything is okay, everything works. We got electricity, we got running water, we don't see any kind of major issues in that home. We'll bring in the devices, we'll bring in basically the staff to help you. Now, again, look at that cost. Location, location, location. I told you at the top of the call. Whoops, sorry about that. I talked to you at the top of the call. I'm going to talk about local. We've heard about location and the way that business is run. We see that basically where our charges are hospitals, basically. That's where basically things get a lot more expensive. So if we can have the same kind of care, you can basically have your client, our member, at home using their remote, maybe in their bed, maybe they do need a medical bed, all right? But in a setting that they are comfortable with, that's where you're going to see a lot more drastic drop in the cost. All right. So you look at what it's saying there. Why does it say 60? Hey, bottom line is what you're seeing is you're paying that $250 for however long you're dealing with that scenario. Right. That's what you need to really understand. Telehealth. One of the things that CareN'Care did, you can't turn on TV, you can't see social media, you can't open a newspaper or magazine without hearing basically folks talk about mental health. So we got a lot more aggressive this last year. Currently, we sit at $40 for telehealth with regarding mental health specialists. We've dropped that down to $25. Again, more aggressive. Think about that dozen eggs. We didn't cover specialists in the past. All right, we covered PCPs, we covered basically mental health. Now we've added specialists in that scenario for specific scenarios. Obviously, we have cardiologists on there. You're not going to have an open heart surgery done in a telehealth situation, right? But there are basically reasons, there's follow-up, there's many different sources in that or situations that can be very helpful. And oh yeah, look at what that cost is in that. If I'm talking to see a specialist, $35, don't mean to flip the screen on you so much, but $35 basically to go see a specialist. You're paying the same thing. You didn't have to find a parking place. You didn't have to drive. You didn't have to fool with any of that. Maybe in some areas, you might even have to pay a toll to get there, right? So all in all, you can do that in the comfort of your home where you're comfortable, especially when we see people that are convalescing or recovering from basically specific surgeries that a lot of those specialists could possibly be working with you on. Occupational therapy, same, no big changes there. a little more aggressive basically when it comes to speech, physical, and language visits. Home health, same, no changes there. Ambulance did go up. Cost of ambulance was $200, hopped up that $275. You're going to use a little JP16, which is helicopter fuel. You're going to be spending basically 20% for that ambulance air. Urgent needed care. So before I go into urgent needed care, I'd really like to skip down to emergency room. I know this market fairly well, as many of you do. And the market standard is $90, basically for ER. And as I go through this bid process and I look at basically two of the most important audiences that I serve, which are basically members and agents, okay? Members of CareN'Care and you as an agent, you as an agency. They came and said, hey, we're going to move this up to $100. You know, what's the impact going to be? I'm like, well, it's going to be very impactful. I don't like it. My agents aren't going to care for it. Their members aren't going to care for it. If you're going to take that away, what are you going to do for me? What are you going to do for me? What are you going to do for my two audiences, right? Well, what if we basically dropped urgent needed care? I'm like, well, urgent needed care, yeah, it's pretty aggressive already. I mean, that makes sense to you? But I can deal with that. $30 for urgent needed care. If you look at urgent needed care, basically in this market, you're looking anywhere between $45 and $65 in that scenario, right? So if I'm already sitting at 30 and you're going to make it 25, doggone it, that's cheaper than you going to a specialist. All right. So I'm always out there trying to basically vie for basically my agents and my members out there. And again, we look at where the location is. Where do we see emergency rooms tied to hospitals? Urgent needed cares most likely are going to be very separate from those facilities. It is less expensive for my organization to work in that scenario, right? So you see those urgent needed care, you will see that. I'm spending a lot of time on this PPO choice, our most popular PPO plan. I won't spend this much time on all of them, but you will see this trend throughout my full presentation through all 6 of our plans, right? So all in all, we see that urgent need care is getting a little more aggressive. ER did go up $10 up to that $100 area. Ambulatory surgical center, that dropped down. Remember, location, outpatient, hospital, that popped up 25 bucks. All right. So we look at lab service. This kind of frustrated me a little bit when I first saw it. It says 0 to 10. I'm like, come on, man. What the heck is 0 to 10? Who basically, I mean, you got to, the first thing a prospect is going to ask, an existing client is going to ask, an agent is going to ask is, oh, what's 0 and what's 10, right? Well, if it's done in the doctor's office, 0. LabQuest, okay? On and on. If we look at maybe LabCorp, 0. Where does it run into the 10? Again, if a doctor asks you to basically, or ask your client to go out and have that done in a hospital setting, an outpatient hospital facility, location, it's going to be higher. So if they're doing it basically in their office, if they're doing it as a standalone basically lab out there, such as a LabCorp or a Quest, something like that, basically they're going to continue paying 0, right? Outpatient x-rays, 10 and 25, same, 10 in, 25 out. Most certainly Silver Sneakers is part of our program, a staple basically within our industry. Maybe not everybody's using the brand of Silver Sneakers, but they have some type of no additional charge basically for a fitness program, a healthy way of living basically kind of program. We most certainly are working with the ones that started the whole program, which is Silver Sneakers. OTC double. OTC is $30 right now. That's $120 basically a year with OTC. Our OTC has gone up to $60 a quarter. That is a total of $240 a year. And another one to add to that list of that local aspect, our company that we use, our vendor in the situation of OTC, sits in Lancaster, Texas. Guys, that's south of Dallas. It's just south of Dallas. Okay, it's in the burbs basically of downtown Dallas. So again, that's local. I was talking to one of our members not too long ago. They're like, it's like same day. It's like Amazon. Whoa. It's not Amazon. I'll be surprised if you got a same day. Maybe you got next day, but all in all, it's local. And just as any of these organizations out there that are working with OTC, there's no charge for any type of delivery. Preventative dental. I need to actually update this slide, and I need to add one more aspect that is built into my plan, which is preventative dental. And we also have a dental rider, but before we talk about that, let's talk about that preventative dental. We have cleanings, we have x-rays, oral exam, and the one that I'm missing is fluoride. That is built into my plan. Okay, there's no charge for that. There's no co-payment for that, right? Now, the whole thing is, we know if we go in for a dental exam, what are they going to tell you? You need to work on this and that and this and that. Well, this isn't looking too good here. And then you're looking at basically, hey, I need a crown, a cavity, a deep cleaning, what have you, right? Maybe dentures, maybe an implant. Well, our dental rider basically is there to cover that. On our PPO plans, basically in 2022, that price is basically $26. That is flat this year. It's $25 on all of my plans. This current year, basically, it's 25 on HMOs, it's 26 on the PPOs. I'm like, that's way too confusing for me. I don't know if it's too confusing for you or your clients, but at the end of the day, I want to make this thing simple for me as much as I want to make it simple for you. So it's flat, 25 bucks basically for our dental rider. Later on in our presentation, after I'm done going through each one of our plans, we'll talk a little bit more about what specifically is covered in that dental rider. You're going to see a lot of stability here when we talk about vision, when we talk about hearing in our plan. There's no changes at all in these areas on all of my plans. It's very, very flat, very, very same. I've talked to basically individuals that are using these hearing aids. You know, hey, these things are from Germany. That's good. I assume it is. I don't know if it's quite a Mercedes or a BMW, but at the end of the day, they feel very, very confident, feel that they're getting basically, even at $999, they're getting a $3,000 plus hearing aid. Now, that is per ear in that scenario. I want to make sure I'm right up front with you, because I expect you to be right up front with your clients and your prospects. So, medications. Drugs have always been an area where CareN'Care has really stood out amongst a lot of national, very strong national players in a very, very competitive market. If you're not aware of this, the CFW market is one of the top, I would say 2 to 3 most competitive markets in the United States. It kind of, flips maybe left and right a little bit, up or down, what have you, however you want to look at it, basically if we look at a Miami and we look at basically an LA, this DFW, you look at where the cost of medicine is here compared to those two areas, this is a very, very competitive. There's a lot of folks in this market. John and I remember days where there was only one Medicare Advantage plan even in this market. And now you look, and I guarantee if we look at all the different plans, I'm not talking carriers, you're pushing well over 100 different options that these individuals in this community basically have to choose from. And that's where you come in. That's where you come in and helping. Hey, what's the best thing for them? Yeah, I know you already have one, but hey, is that plan serving you to the max? Is that taking care of it? I can tell you, my health has changed from, I'm 53 years old, right? When I was 35, basically my health was way different than it is today. And we see as our population, as our clients, as our seniors get even older, their situation's changing also. And that's where you guys come in. That's where our agents come in to understand, hey, right person, right product, right plan. Okay, or right time, excuse me. Right person, right product at the right time. All right, timing could change. Right, that product could have been good for them when they were 68. Now they're 70. Hey, something's a little bit different. Doc put me on a different medication. Talking about medications, here we are. One of the things that we added in here at no upcharge is 100 days. 100-day supply. That's 40 more basically pills or servings or however you want to look at it. Doses. I don't know what servings. Shouldn't use that word probably. But all dosages basically a year. And they're paying the same thing. And check that out. Whether it's retail, local, or it's through the mail, same cost in that scenario, right? You're seeing a lot of similarities in this situation. So all in all, I don't know, this is an area we've really stood out. One of the areas that basically you're going to see that all plans have to cover is what? They're going to be out there covering the insulins through the gap. Where we really, really stand alone or stand apart from everybody else is we also cover up to 11 different inhalers. Think about it, guys. Somebody basically hits the donut hole. Yeah, I know they're only paying 25% for the drug, but if the drug is $700 and they got to pay 25%, that ain't cheap. Not when you look at an economy that we're at right now. How much is a dozen eggs again? Only $10, man. All right. But all in all, what happens to that individual? There's no medication coming out there. They're out. They don't have a refill. We got an ambulance. We got an ER, maybe a hospital, and that's the best case scenario, right? Think about that. How are you unique as an agent? I'm telling you how CareN'Care is unique as a carrier, as an option for you. You run into somebody basically who's working with any type of inhaler, you need to stop. You need to go check out some CNC in that scenario and see if one of those medications basically is on that list and is covered basically $70 in this scenario. Buy 2 months, get one free is really where I'm coming from. But basically looking at $35 for 30 or $70 for a 90-day, or excuse me, a 100-day supply, right? So all in all, you see very aggressive drugs. Something else I want to look at before we get much further. I want you to focus here on the logo. I want you to focus on that logo. And I'm going to be quiet actually for 3 minutes, believe it or not. Yeah, I'm still here. There's no D in CareN'Care, man. There's no D in CareN'Care. What are you talking about, Steve? There's no deductibles. You will not see any deductibles on any of my plans. You will not see deductibles in vision, not on dental, and most certainly not on drugs. All right? No D in CareN'Care, guys. So we look at our Choice Plus plan. Not going to spend quite as much time on this plan basically as I did the plan before. Drop down a little bit on the premium. This is $55, $3,800, a little more aggressive basically there on this plan. And then we also see basically that 89 out, right? Primary care was 10 and 40, dropped down to that basically 0 and 20. Same, basically specialist, podiatry. A little more aggressive basically when you come in inpatient hospital, skilled nursing. Again, that last 50 days is you're not making any kind of co-payment in that scenario. Added the nurse line, added that basically Texas healthcare at home. But this is just one more option we have for folks out there. A little more aggressive once again, you see as far as in network. I mean, telehealth, PCP, instead of 10, it's 0. $25 basically as far as mental health, more aggressive as we talked before. $25 basically you see those virtual visits basically we have out there. John talked about it in the opening. Hey, these guys are getting more savvy. They are getting more electronic because everything they access is getting pushed from their bank to their church, what have you, right? You will see once again, ambulance hopped up. Ambulance got a little bit more aggressive, a little bit more expensive. We see basically that urgent needed care, it dropped, while basically the ER hopped up a bit. Ambulatory center, again, it dropped, but then when we see outpatient surgery, outpatient hospital facility, it goes up. All right. Labs, again, office, doctor's office, LabCorp, you're good to go. Quest, you're good to go. You start putting yourself in a hospital setting, you're gonna pay $10 in that scenario. Double that OTC once again, $240 in that scenario coming out of Lancaster, Texas. And again, we have that same type of dental. Please excuse me, should also have fluoride also included in there in the 4-0 covered preventative dental services that are included, embedded into the plan. We'll talk about that dental a little bit later. Again, we see basically the consistency across the board regarding that vision and that hearing. Same, fairly aggressive in the market. Medications. Now, this plan does not have the 100, so pay attention on that. Your 0 premium plans will have the 100-day. If there's a premium on a plan, it's going to stay at 90. Little trick there. A little more aggressive on your tier 4 drugs by $2 and $4 basically on the 30 or 90. Another thing I wanted to talk about drugs. Do I have a preferred pharmacy? I do. They're all preferred. Or you might say he doesn't have a preferred. Sales guy is going to say they're all preferred. I don't have one over the other. Whether it's basically 3rd generation, Smallville, basically Texas, okay, I knew his grandfather. I knew his father basically as a pharmacist. If that's where you want to go, hey, paying the same thing, same kind of rate as if you were at Costco, Sam's, Walmart, Kroger, CVS, Walgreens. I can keep going and going. All right. So all in all, understand that everybody's preferred. This is a very interesting plan. This is a plan that my organization, and I take responsibility for that, has not promoted to the fullest. So I want you to look at this plan closely. So today, this plan costs $200 a month. This is an MAPD, man. Yeah, it's an MAPD. It's going down to $194. Woo, woo. But what do you really want to be looking at? You want to be looking at these co-payments, man. If you stay in network, it's zero. Even emergency is zero if you stay in network, right? Inpatient hospital is, ambulance is. So it's kind of a unique plan. I saw this basically in a different market several years ago, probably around 2015, 2016. I saw a fairly aggressive premium on a Medicare Advantage. Wondering what the heck is going on here? Kind of a zero premium, right? That's how I grew up. That's what I sold. Medicare Advantage plan was always zero, right? Well, this is a really interesting plan. We're going to talk a little bit about it here shortly. Right person, right product, right time, right? We mentioned that before. Who's this individual? What does this basically prospect look like? What does this existing patient or existing member that I already have, maybe on a different product, what does that person look like? So let's go talk about those benefits like I slammed through there. Hey, you saw basically that nurse line got added. You see the zero at home in that scenario. You got to ask yourself, well, how in the heck are you going to get the $3,500 if it's zero? I got to throw it in there for the bid, okay? I'm just putting it in there for my bid. There's no way you're going to get $3,500 basically if everything's zero. Go out, if you really question me, go out and look at some of your dual SNP plans. How in the heck did they have basically an out-of-pocket maximum on them if everything is going to be a zero? Again, this is not a dual plan. This is not a dual. A and B, live in the county. That's what makes you eligible for this plan. I don't think it would be in the best, sense of basically working with an individual that was dually eligible, whether you were at the, the lowest part of the federal poverty level or the highest part of the federal poverty level, to even be basically involved in a plan that's going to have a $194 premium, right? Don't think that's probably right person, right product, right time. But all in all, you see my zeros going through. You see basically doubling up on the OTC. And there's that dental rider. We'll talk about that a little later. Very flat when it comes to basically the hearing and the vision, as we've talked on all of our plans. A little bit of changes here, a little more aggressive on your generic medications, dropping $2 and $4 on the 30 or the basically 90 days. Remember, there's a premium here, so it's just 90 days. And then our tier 4 medications and tier 3 did hop up around $2 to $4 there. But let's talk about it. Well, who's going to be a person that would be right for $194? Well, maybe they're currently on a med sup, but due to some medical issues, hey, they want to change some plans and they're not going to be passing any underwriting and move to another med sup. Just think, they're currently on a med sup, they're paying well more than $194 basically. All their providers are in network. How many people have you talked to out there? Hey, I don't want that kind of plan. I don't want that kind of plan. I want to go see my doctor. And you look up their doctor and their doctors accept the plan. That's the kind of individual I'm looking at for this CareN'Care Choice Premium plan, right? $194 includes that Medicare Part D coverage. It's all built in. I call it the Happy Meal. It's one card. It's all together, right? It includes basically that coverage for those COPDs and those insulin through the gap, right? Plus all the extras, the dental, the vision, the hearing, the mom's meals, the silver sneakers, the virtual basically visits, right? All of that, the OTC, right? It's $240. They're not most likely getting on a med sup. At least, hey, teach me up, learn me up. I'm not seeing any kind of med sup out there with an OTC benefit on it. Maybe there's something new coming out. Reach out, let me know. All right. They stay in that network, zero copays, including that drugs. Huge savings for this individual. I run into these members And these members love this plan. We don't see a lot of people get on this plan and not stay on this plan. This is our stickiest plan that we have out there, all right? And I think basically dropping basically this, $6 a month, increasing basically that OTC is going to make it even stickier. But let's talk a little bit more about this plan. If I take an average 68, 70-year-old individual, average med sup rate, let's talk about a part plan G out there. I think I'm being fairly, liberal, but $132. Okay. Look at my math. Kind of focus on that left-hand side of your screen right now, right? Average basically prescription drug cost deductible. We know that's going up. Actually, in 2022, you could have it as high as $480 according to Medicare for either a standalone PDP or an MAPD. I'm throwing it in there at $380. Got to pay that deductible. Yeah, I know it dropped a little bit from 2022 down to $226, right, for 2023, but still, check my math. Doesn't take you a whole lot, basically, to get under it. Save a heck of a lot of money if, big catch, if everybody's in network. So you got to verify that. Again, those parents, there's a strong draw on those parents. There's a ton of folks that have that kind of fan club for that UT Southwestern and that THR in this market. And those are the kind of individuals that basically I see being very, very prone or very, very great candidates for this type of plan. So we got an MA only plan out there. We did throw a $10 give back on this plan. It's a fairly aggressive plan already. I mean, it's cheaper to go to the hospital in this scenario at $50 than it is to go where? The emergency room. Emergency room is $100. Hospitalization's $50 basically in that scenario per day, right? Add the nurse line in there, added basically the Texas Healthcare at home benefit. Got a little bit more aggressive once again with telehealth as we did with our other plans. Ambulance basically did go up a little bit in there, $50. Urgent needed care got a little bit more aggressive, $25, man. I mean, that's pretty doggone low to go to urgent needed care. Rest of my benefits stayed relatively flat. We only moved to $40 on this plan. So there was this only plan where we went up basically $10 with OTC. The dental basically is embedded, and then we also have that rider. Very, very stable here. Yeah, there's not going to be a next page because it's an MA only. It's an individual baby TRS, baby VA, right? Individuals that have basically that credible drug coverage, right? So when we put an individual on this, go signing them up on a standalone drug plan. That's not going to work. We're running a lot of issues there, right? MA only. This person has credible drug coverage through maybe a former employee, maybe some kind of situation like that. If you have questions with that, stop, ask your upline. Okay, stop, reach out to CareN'Care. We'd be happy to help you in that. Don't want you to be in that scenario. Let's talk about our HMOs. We have two HMOs. We'll start out with our oldest HMO, our classic HMO. This plan did go up a little bit in some of the areas. I wanted to differentiate this plan with our Southwestern Health Select, our newest basically HMO. But you basically have a zero premium, $3,900, staying under that 4,000 ceiling there as far as a move goes. So I see that being fairly aggressive within our market. $35 went up a little bit on that specialist copay. Inpatient hospital obviously went up just a little bit there. Skilled nursing, nurse line basically was added. We also added that telehealth, or excuse me, that Texas Healthcare at home benefit. Oh, and telehealth, excuse me. A lot more aggressive there with the telehealth, as we talked about on the PPO. See a little bit of change here once again. Again, hospital or emergency room hopping up basically $10. Fairly aggressive at $30 already. Again, I mentioned 45 to $65 basically is what we're kind of seeing is the median there, average basically for an urgent needed care visit. So we were already kind of there in that scenario. Ambulatory dropping Outpatient hospital facility, again, location, hopping up. Got that silver sneakers, double that OTC, have that basically built-in dental and have that dental rider. Very consistent across that hearing and that vision benefit, as we've talked before with our plans. Medications, it's a zero premium plan, 100 days on CareN'Care. A little more, about $2 to $4 on a 30 or a 40 on your tier 2 and your tier 3 drugs in that scenario. But again, no deductibles. That part, that's what I'm excited about. No D in CareN'Care, guys. So talk about that Southwestern Health Select plan. And this plan was sitting in the market between number 2 and number 3. Basically, is the lowest out of pocket, the lowest MOOP, maximum out of pocket in the Dallas-Fort Worth market. I still feel even moving from 29 to 32, $100. That's pretty doggone low. It's still probably going to be in that 2 to 3 zone within our market for an HMO. Again, this plan is only offered in Dallas, Tarrant, Denton, Collin, and Rockwall counties. Specialist copay was 10, moved up to that 15, 0 for the PCP. Inpatient hospital, little more expensive, a little more aggressive this next year. Nursing home or skilled nursing, that lasts basically 40 days, no charge basically in that scenario. Added the nurse line, added the Texas healthcare at home, and again aggressive with basically the telehealth, specifically around that. All the way down to $15 basically for mental health services. Occupational therapy visits actually dropped a little bit. Speech and language, physical jumped up a little bit. Home health, everyone stayed the same here, flat, same, no change. Basically, urgent needed care, again aggressive at $30, stayed there. Yep, that ER did hop up $10. Outpatient hospital facility, that one jumped. Once again, ambulatory, separate from the hospital, stayed the same at 150, fairly aggressive. Your lab, as we said before, LabCorp, Quest, scenarios such as that outside of a hospital setting, PCP's office, specialist office, you're going to be paying 0. OTC hopped up, doubled it up, give you $240 a year in this scenario. And once again, you see that preventative and that dental rider basically there. Vision, hearing, boom, flat, same, no big changes there at all year over year, 2022 to 2023. Medications basically stayed flat. This is very aggressive. Guys, that's not a misprint, man. You're talking a tier 2 drug, 100 days basically, 0. Very aggressive. And guys, this isn't just me talking about this information. Go look at Medicare.gov. You're going to see basically a lot of bubble up basically on CNC, on CareN'Care in that scenario. And one other item that I wanted to touch on this as I'm wrapping up our plans here. Got a couple other slides for you. We'll wrap this whole thing up. But basically understand where vaccinations are with Part D and Part B for this next year. Those are scenarios that Medicare is coming out and saying, hey, Medicare Advantage Plans, carriers got to be covering these drugs basically at 0. At no cost you see down here, all right? So what kind of sets us apart? Those tier 1 coverage through the gap, those COPDs, those insulins covered through the gap, those really do set us apart. And we know between providers and medications, those are the 2 biggest concerns of our Medicare population nationally in that scenario, right? Basically, hey, it's about my drugs, it's about my doctors. I want to have access to the physicians I want to see, and I don't want to overpay for my medications. CareN'Care most certainly isn't in that scenario. And look at the last bullet, just as I mentioned earlier, but check Medicare.gov, especially if you have an individual that's working with any kind of an inhaler or a pumper. New, got that 24-hour nurse line we touched at, that Texas healthcare at home, 100-day refill on a select few of our plans out there. We didn't talk about this one, but basically our enhanced mom's meal benefit, right? So right now we already have it set up. You get basically 3 meals a day for up to 10 days after your discharge from a hospital stay. All right. Something we've added 10 chronic illnesses, right? And those 10 chronic illnesses, if an individual is going to do care management through basically CareN'Care in that scenario, for each one of them, they have COPD, they got congestive heart failure, and they got diabetes. They just added 30 more meals to them on top of if they got, discharged from the hospital. So all in all, if you have questions about that, or you have questions about that, certainly reach out to me in that scenario. I'd be happy to answer any kind of questions. Talk to our agent support team. They're always out here to serve you. So these are our basically supplemental benefit vendors that we work with. DentaQuest, we're getting ready to talk about that here. Next slide. iMed for the vision, True Hearing for our hearing aids, obviously Silver Sneakers, MD Live for that telehealth, and like we just talked about, the post-discharge, along with basically this chronic illness meal benefit with Mom's Meal. So here it is. What's the catch here? Pay $25 premium to get $7,500 annual benefit, right? No deductible, no waiting period, and oh yeah, dentures, implants are covered. That's the plan. What is the catch? Two catches the way that I look at it. Number one, you got to go to a DentaQuest dentist. So it's a network of dentists you have to go to. Number two, you have to basically pay up to 50% of the cost. All right. So bottom line is you got a crown cost $1,200. You're going to pay $600. Okay. Your client's going to pay $600, and CareN'Care DentaQuest is going to pay the other $600 in that scenario. So it's up to 50%. So we look at $7,500. We're like, whoa, that's a lot of money. But to truly basically exhaust that benefit, to get the most out of that benefit, to get the full $7,500 for the $25 a month that you pay, you're going to have to spend 15 grand. Now you start talking implants or dentures, man, you're going to spend a heck of a lot more money than you think. Implants are not expensive, are not cheap. They are fairly expensive. And you got an extraction first, you got a pop post on there, then you're basically putting a crown on top of that. All right, you're going to run through that. That $7,500 is going to go pretty quick in that scenario, especially if you're only talking 50% of it. So basically, it's eligible. It's available out there. You might have other plans that basically you can sell in an ancillary scenario that are more aggressive or better for that individual's specific needs. You're out there. Just as we talk about a Medicare Advantage plan, right person, right product, right time. Hey, dental's the same way. Dental's the same way, right? So maybe this isn't that. We have an option there. If it's the right thing for them, hey, great. If it's not, hey, work with a different option out there. I know that Premier Marketing most certainly has several different options when it comes to that situation. So, CareN'Care agent support. Hey, we're here to support you. We're local. We have these basically, we understand our market, we understand our community, we understand our network, we understand a lot about our competitors, we understand what's going on here. We're from this area, right? We're here to help you, different kind of trainings, help you out with basically understanding what the benefits are, help you find basically provider for a client or whatever, verify that coverage, claims, billing, hey, they're going to call you if they have an issue with the scenario, right? You basically can bring that back to us, go back to them with a solution in that scenario, or we'll help you with that solution. At the end of the day, that makes you what? That makes you referable. You want to basically have these individuals talking about you, talking about the service that basically you give them. How are you different from somebody else? There's tons of licensed and appointed agents out there. What are you doing that's unique? What's your unique selling point? I'm going to tell you, it starts with customer service. You take care of that individual, and we're here to support you in doing that. All right? Get you the information. You go out there, take it to them, let them know what the solution is, and boom. Hey, you look like Superman. I don't need to look like Superman. You need to look like Superman, right? That makes you more referable. That drives your business. If I can make your business successful, I'll get mine. I'll get mine if I can make your business successful. Contracting commission, we're most certainly here for that. We most certainly want to get you paid, right? Different kind of quoting for platforms that we're working with Sunfire, we're working with Connecture. I know that drives into the Integrity family, basically, and you should have access fee to do that through the Medicare store. Telephonic recording solution. if basically you're looking for another resource and something like that, we have it. It's no charge for you. We have basically that solution ready for you. So whatever you're more comfortable with, I know that basically Premier basically has that solution already set up for their agents. But hey, if you need a backup or something else, CareN'Care most certainly has that solution. Keep you safe in this new way that we basically represent plans out there to our community. It's an awesome team I have an opportunity to work with, and I have an opportunity to partner with. Miss Trish Cloud, and that's my tenacious Trish. I look at Tom Ty basically. Tim Ty basically is he really is. He's a Swiss Army knife of our organization. He's there to help in all kind of scenarios. I swear he's got a fan club of agents out there. I introduced him in a face-to-face meeting, and people wouldn't stop hooping and hollering and getting excited about it, which is very exciting to me, and really basically just brought a huge smile to his face. He really appreciates basically that endorsement. And the newest addition to our team is Mr. Michael Arnold, Mr. M.A. Michael Arnold. Michael had sold in the field for the last basically 8 years, so brings a lot of that strong current field experience to our team. But all in all, I can't tell you enough how excited I am basically about this AEP. I hope you're excited about this AEP. If you're not, get a hold of me. You get a hold of me through John. I'll give you my phone number right now, so you can grab a pen and piece of paper. I'll give you a second to grab that. That phone number is 817-706-6465. One more time, 817-706-6465. I'm here to serve you. I'm here to serve your clients. John, man, once again, man, I'm super excited about AEP. I can't thank you enough for basically having me as your guest today, being part of basically the Premier Marketing team as far as different carriers and plans that are offered. But I want to bounce this ball back to you, big boy.
Alrighty, Steve, I'm going to check real quick for questions. And you, as usual, have done your thorough job. I have nothing there that we need to expound upon. I'm going to take control of the helm back from you.
Outstanding.
And finish up really quickly with a few slides, and we'll be done with today's presentation. And hopefully folks will realize the value that your organization brings to North Texas and to not only the Medicare population, but the agent population that we service as well. Much as what you said, we have two audiences that we work with, and your organization does a great job with both. You'll notice that on this slide, we do have Steve's contact information on there for you. And so without further ado, some different things that we'll go through and speak of. And I am going to slide through a lot of slides because this is what Steve just went through in a previous presentation. So there we go. Once again, we thank you. We have a number of strengths that we have at Premier Marketing, I think, that can be a great value to you as an agent as well, particularly in working with quality organizations like CareN'Care. We have an electronic contracting process through SureLC, Surance Bay. When we speak to the different carriers out there, we want to make certain that we can get you through the program's contracting process as quickly as possible. We use this a lot for ancillary products. With strong carriers, we will do some direct links there for you as well. We do offer discounted E&O for qualified agents. What makes you a qualified agent? You got a contract with us. Shocker on that. And it, however, allows you to take care of this requirement that the insurance companies ask of you, regardless of whom your contracting hierarchy is. You own this program. So it's not like being added to a blanket E&O for one program and you worry about coverage elsewhere. It's yours, you own it, and you use it with the carriers with whom you contract. We do also offer discounted continuing education programs through our association with WebCE, and we give you an opportunity to add to your own benefit package through a modified guarantee issued disability income program on which you're paid a commission on a plan you sell yourself. Much as where today's presentation is being recorded and is available on our website, as we mentioned at the top of the show. It's also on our YouTube channel as well. And you'll find a number of presentations out there that speak to carrier-specific programs, but also marketing opportunities and how to get in front of people through organic means to grow your book of business as well. I cannot overspeak the value of this program, Medicare Center. There are constant improvements coming on this, and I noticed on this that I haven't got a couple of them on here for you. And in addition to it being available, as JJ Walker says in those terrible commercials, it's free. Well, it's a single log on to multiple quoting engines powered by Connecture, Sunfire, and CSG. It allows you to do those plan comparisons side by side on a compliant basis after you've collected that scope of appointment, which is what's available here through multiple methods as well. And it stores that for you for that 10-year period, which brings us to the point of it does that same thing for the call recordings that's required of you. So they are available through this program. We have different demonstrations that can help you become comfortable with that. And it is stored for you also for a 10-year program. It has a contact management system, a CRM for you to work your client base year over year, and other learning resources, including call scripts and other things that can be very useful for you. A couple of things that have popped up recently is there is a mobile version of this as well for your smartphone. It also is bringing forward for you the pearls, the microsites, your websites that give you a presence on the internet as well, and a new program called Lead Center where you can purchase leads through this program, and it can be sent to you either in print or live transfers depending upon your preference. I'm not much of a live transfer guy personally, but a lot of folks have good success with that. I like to make certain that I have detail. I like to not have someone just get shifted over to me, whatever, but that's up to you. Some folks do it very, very well. But this is a program available to you without cost and is a great tool for you to use as an agent contracted with our organization. We also want to make certain that you realize full breadth of the compensation that you're entitled to with different programs. MA and PDP programs, the max comp is set by the government, so you don't see a lot of carrier incentives for these. None, basically, that I'm aware of. There are some different things that carriers will do to help you with AEP and some other things, but this gives you an opportunity to look at the package, particularly with Medicare supplements or ancillary programs, and learn of those extra marketing dollars that may be available to you that also help you qualify for carrier trips in many circumstances, and incentive programs through our organization as well. We do work to make certain that you have the information that you need to get in front of people through different programs. And it includes folks that like to smile and dial. Obviously, you can't do that for MA or PDP, not if you value your contract anyway. But you can do that for Medicare supplements, and you can do it for dental programs. We see a lot of folks use that as a door opener. We have different programs also that make you comfortable with working the retail opportunities that are available through Walmart and different carriers. Make sure you maximize your return on your investment in those programs, but also systems put in play to help you work with and through faith-based organizations and providers as well. Some carriers do generate prospects for you, mostly in the MA and PDP world, and we want to make certain that if you're eligible for those, that you're able to take advantage of them. We do have an internet lead program as well through social media, direct mail support, a T65 locator, and a referral program to remind you to basically ask and when to ask and how to ask. And it can make a big difference on taking one lead. And to go biblical on you for a moment, go forth and multiply. That's what we want to do with the referrals on any lead program to help you grow. That mail program is based on production, but drives down the cost so you can do some things consistently. 2 different programs, one for health programs and one for final expense. So you can qualify for 2,000 mailers each month, depending upon your production. And we do use preferred lead vendors. We vet them for their systems to make certain that they can get the returns on these mailers to you as quickly as possible, and that the correspondence that they're using to solicit these responses are compliant, and we take care of you in that fashion. We do also have different lead programs available through one of our platform partners that are direct mail lead responses. The cost varies by lead type, areas, time of year. It's very market driven. These numbers here are the most expensive numbers that I've ever seen with these programs. We want to give you worst case scenario in this situation. Great way to fill in your schedule or use it as a part of your regular marketing activity. Those internet leads are Facebook placed or Facebook generated, I should say. They are available for final expense and Medicare as well. And that T65 locator gives you an opportunity, should you be in an area like Steve and I used to do, where we would switch leads back and forth to make certain that we could minimize our drive time and our windshield time. If you slot in appointments and one cancels on you, this is a great tool for you to see, well, who in that area might be in a certain age demographic I am after, and I can go door knock to see if they're interested in final expense, med sup, dental. A great way to help people in those areas and fill in your time and maximize that most precious of resources for you, your time. We want to remind you too that that referral program is not just for a selling situation. Keep in mind, you want to ask repeatedly through the course of your conversation with the folks you're selling, for the folks that you don't get a sale, but as importantly, going back and visiting with Bob, your book of business, and remind them that as you go through and do your reviews that, hey, you want to offer your services to friends of the folks, friends, family, whomever, of the folks that are already your customers, and make a difference that way as well. We do all this because we want the opportunity to work with you. We want to be referable to you so you speak to your agent friends about us. And we urge you to take these programs that we discuss and put them to play immediately. Steve's program with CareN'Care. Man, we still have 11-1 and 12-1 effectives. They have a grand opportunity with their programs to help you now. Keep in mind the business that you write for Medicare Advantage plans during annual election period. When do you get paid? After the first of the year. So we want to make certain that you're able to generate business now in the Medicare arena, but perhaps we look at dental programs or other things to make certain that we have the dollars to come in so we can be like Charles Dickens' folks that he sees in the Christmas story, and we get the big goose instead of the little quail. We want to be able to eat through the end of the year as well, give you the opportunity to put these programs in play immediately. And as John Wayne said in the movie The Cowboys, slap a piece of bacon in the biscuit, saddle up, let's ride, because we're burning daylight. Don't procrastinate, put it in play. All that said and done, I'm going to check really quickly to make certain we have questions covered. We're good. I want to thank you. First off, for the folks that have done business with us in the past. Thank you for that opportunity to do so. Thank you for that business. We look to enrich, and grow that partnership as well. For those of you that are considering doing business with us, I'm having challenges with what I'm saying today. I apologize. But for those of you that are looking to do business with us now or considering it, thank you for the opportunity. We hope to earn your business as well. And thank you, Steve Plocek, for your presentation. And thank you all for your most valuable of resources, which is your time. We thank you very much for spending that with us here today. And we look forward to conversations with you in the very near future. And until we're able to do so, we wish you good selling. Thanks so very much. We'll talk to you soon. Thanks again, Steve.